Welcome to the University of New Haven's COVID-19 overview. My name is Summer McGee, and I'm the Dean of the School of Health Sciences here at the university, as well as the university's COVID-19 coordinator. In addition, I am a public health researcher and scholar for multiple decades who has spent a lot of time in the last few months sharing with the public the basic scientific and public health knowledge that everyone needs to have as we fight this global pandemic. For the next few minutes, I will be sharing with you some basics about COVID-19, some scientific and public health knowledge that I think is critical for everyone in our university community to know and understand as we prepare to reopen our university for the fall. COVID-19 is a novel virus that was discovered in late 2019 that is spread primarily through bodily fluids and particularly respiratory droplets. These droplets containing the virus can be inhaled or can enter the body through the eyes, nose, and mouth. Transmission of the virus can be direct from person to person. It can also be indirect via surfaces, although that is not the primary way that COVID-19 is spread, or through aerosolized particles containing the virus in the air. There are numerous ways in which someone can possibly be exposed to COVID-19, but there are two most likely scenarios. If you are within 6 feet or less of a COVID-19 positive person for a long duration of time, approximately 15 minutes or more, you have a significant risk of being exposed to COVID-19. A recent study in The Lancet showed that individuals that were 3 feet apart or less had a likelihood of contracting COVID-19 of around 13%. Individuals who were 6 feet apart or more, that risk dropped to 3%. So it's absolutely critical that we ensure social distancing as a part of our response to preventing the spread of COVID-19. It's also critical that individuals take actions to prevent the virus from being able to enter our airways or our eyes or mouth or nose. That's why we recommend using face coverings or the use of personal protective equipment. These tools prevent those bodily fluids from entering our body and from potentially exposing us to COVID-19. If you believe you have been exposed to someone who is COVID-19 positive, the most important thing you can do is to self-quarantine for 14 days. You want to limit your contact outside of your home so that you aren't accidentally spreading the virus to others. What we know about COVID-19 is that somewhere between 25% to 50% of people who are COVID-19 positive individuals are asymptomatically spreading the virus to others. That's why it's not just enough to be monitoring for symptoms, but you need to be aware of who has been exposed to the virus, and if you think you have been exposed, regardless of whether you have symptoms, to stay home and self-isolate until the incubation period, which is approximately 14 days, has passed. It is important while you're in your self-quarantine period to monitor for symptoms. Upon any symptoms developing, you should of course contact a healthcare provider. And if any severe symptoms were to occur, such as difficulty breathing or high fever, you should of course seek medical attention immediately. The symptoms for COVID-19 really range very widely. There are the most common symptoms of upper respiratory infections, including fever, cough, shortness of breath, and fatigue. But what we've seen over the last 6 months is that COVID-19 presents itself in individuals in a wide range of ways. That includes gastrointestinal problems such as nausea, vomiting, and diarrhea, muscle pain, headache, sore throat, and even a loss of smell. So it's really critical if you identify any symptoms that are unusual or out of the norm for yourself. That's something you want to report to our university health services or to human resources, and to stay home for 14 days and self isolate after those symptoms begin if you believe you've had any kind of exposure. It's really critical to make sure that you aren't inadvertently spreading the virus to others, either while you are asymptomatic or certainly once these symptoms develop. We also know that there are a number of groups that are at higher risk of developing sickness from COVID 19, as well as more severe illness. Those groups include those who are older individuals or living in a nursing home or a long term care facility, or individuals who have chronic diseases, including lung disease, cardiovascular disease, immunological problems, obesity, diabetes, kidney disease, and liver disease. It's also critical to remember that you yourself may not be in any of these high risk groups, but if you live with someone who is in one of these categories, or you care for someone who has one of these conditions, that's something you also want to take into account as well as you prepare to return to work or to school.